So let's continue. We are talking about the primary lymphedema. We are ready with that. And now we come to the secondary lymphedema. Most of all lymphedema are secondary, more than 90%. Secondary means there is an absence of any anatomical malformation. So something is coming from outside. The most common are the post-surgical lymphedema, post-operative. That happens every day in every operation theater. For example, after surgical measures like endoprothesis, no matter if you talk about the hip or the knee, the result is the post-op lymphedema. And the post-op lymphedema has to be treated very early because we need to reduce the swelling because the swelling is compressing, is increasing the density in the tissue. So we need to take off the swelling and to take off the edema after the surgery. And that has to be done usually by manual lymphatic drainage. Okay, but MLD, manual lymphatic drainage, is resource and time intensive. Only trained personnel can do so at the risk. What will the hospital do if the manual practitioner, if the professionals are sick, there's an influenza or summertime, they are in vacation, shall they stop doing the surgeries? Vacuumate can do better. Vacuumate is detoxifying the lower limbs completely. It reduces the hematomes immediately, and it even starts the wound healing immediately, actively. You remember, second lesson, the function of the IVT, sucking, pushing fresh blood in, old blood out, exchanging the interstitial liquid, carrying more oxygen, draining away the CO2. All that is beneficial for the wound, for every hospital that operates, for every rehabilitation center, and utmost patient safety. All that is documented, and there is more than one study on that. Another typical surgery is the mastectomy after breast cancer. Also, those patients, depending on how much lymph nodes are extirpated, those patients need lifelong manual lymphatic drainage, which is highly cost and labor intensive. And you know, probably there is a lack of qualified physiotherapists that can offer that treatment effectively. And also here, Vacuumate can do better. Vacuumate, the ANS, Vacuumate arm, neck, and shoulder. That's the device. It's cost effective, it's therapeutically effective, and it's profitable. Profitable for both, for the patients, for the clinic, for the therapist. IVT is a must for every post-operative rehabilitation for the benefit of the patient, the therapist, and the medical facility. This was a post-op lymphedema. There are also the post-traumatic lymphedema. Post-traumatic lymphedema, you all know, for example, the ankle sprain, result of a smash, result of an accident. That is what happens in sports, always, but not only in sports. That's the case. First day after injury, how long will it take? The patient now needs manual lymphatic drainage. It will be a little bit painful for sure because he will get touched. I remember that guy is a football player in Cyprus, Omonia Nicosia, professional. So how long shall the team wait for him? 4 days, 5 days, 1 week, 14 days? With that, or Vacuumate, what they have, no wait at all. Next day, the edema was gone with 2 sessions Vacuumate. only. These are the advantages of the Vacuumed. It doesn't hurt. It can be given immediately. It reduces the edema and starts the healing process immediately. And this is especially important in sports, in professional sports. Sports is money, in military, and in high class medicine. These are your target groups. IVT, the new solution for the treatment of post-traumatic conditions. It's shorter, faster, cheaper, and more intensive. These were post-traumatic edema. There are some more, but once again, we are going to stop for the podcast. Should not get too long. Okay.